The Crono APO-go and Crono pump are manual syringe drivers used for the continuous subcutaneous infusion of apomorphine. They are compatible with 20 and 50 ml syringes. The choice between these syringe sizes can depend on factors such as patient-specific medication needs, dosage requirements, and duration of infusion. The 50 ml syringe can be filled with 13 different concentrations of apomorphine, allowing the dose to be individually tailored to the patient and helping to avoid possible skin reactions that can occur with higher concentrations. The dose is programmed in milliliter, and a conversion table is used to convert milligram to milliliter. For example, the 50 ml syringe is filled with 4 apomorphine pre-filled syringes and 10 ml sodium chloride. A flow rate from 6 a.m. to 12 p.m. should be 6 mg per hour. The concentration is 4 mg per milliliter, and the flow rate in milliliter per hour is then 1.5 milliliter per hour. Up to 3 different flow rates can be programmed, as well as a bolus dose for extra doses throughout the day. The programmed values can be locked, so the patient can't change them. The pump is powered by a battery. Before setting up the pump, disinfect your hands and work surface. Place all of your materials on the table, including a special tray to hold all of the materials. The Crono APO-go or Crono pump, apomorphine in pre-filled syringes, a plastic medication syringe, an infusion set, an adapter, and tape. Place the pump in the tray. Open the plastic syringe package and then pull the stopper out and push it back in once to loosen it. Unscrew the plunger to remove it from the syringe. Place the syringe on the pump and turn it to connect the syringe to the pump. Now screw the adapter onto the syringe. Take the syringe pre-filled with apomorphine, place it on the adapter, and slowly fill the plastic syringe. Repeat this step with the second syringe pre-filled with apomorphine to fill the 20 ml plastic syringe with the medication. Now remove the adapter and screw the infusion line onto the plastic syringe. Disinfect the injection site, so the lower abdomen, inner thigh, upper arm, under the shoulder blade, or in the flanks. Insert the needle at the injection site and remove the grip on the back. Secure the needle and line with the tape. Press the on-off button to start the infusion. You will hear a beep once it's started. The patient can give themselves an extra dose directly after preparing the pump by pressing the DP button. The infusion line does not have to be primed, because this is a subcutaneous application and a dry needle protects against skin irritations. Finally, put the pump in the carrying bag.
So I hope you liked this video. absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.